The topic is clinical management and strategic control of parasitic gastroenteritis. This topic is not only a simple topic, it is a very much important for the livestock farmer, mainly specifically goat farmer. Parasitic gastroenteritis, which is a very much common in the farm level, and the goat farmer are really facing this problem is because the parasites are commonly present in farm and grazing area, so their economy is seriously affecting, as because the small farmer owners are very much not that much economically sound, so their livelihood is mainly depending on this goat rearing. So if the parasitic gastroenteritis is not controllable in the farm level, their economy and livelihood is seriously affecting. So in this today's topic, we will be knowing little bit more about the parasitic gastroenteritis, their control and strategic management. The parasitic gastroenteritis, it causes a different types of clinical symptoms in goat, as because there are different types of parasite, trematode, cystode, nematode, and other protozoal. If we see the prevalence or incidence of the parasitic gastroenteritis in Indian different states, this in this picture the red color indicating the higher prevalence rate, and orange color it is lesser than the red color. So Madhya Pradesh, Haryana, Bihar, Jharkhand, Chhattisgarh, they are the highly affected as per the recent published data. In few literature, it has been found that the 94% fecal sample from the goat diarrhea, it is found parasitic gastroenteritis. It may be of mixed or it may be of single. In a nutshell, if you can say, it is 2/3 of the samples are of mainly parasitic gastroenteritis. So now today's the situation is parasitic gastroenteritis is commonly present in this our Indian climate. But thing is, the problem is the parasites are becoming the resistance against the dewormer drugs and different classes. So we need to think for integrated approach for the management of this parasitic gastroenteritis. So two combination, that is management, that is most important. Second one is drug therapy, that should be judicial and selective. So these three are our weapons, that is proper surveillance of the parasitic, because in all the states same parasites are not prevalent, and in different effective drugs should be given to the affected animal and effective proper management. So combine these three, we can, I think, control the parasitic gastroenteritis. Common gastrointestinal parasites are helminth and protozoa, but small ruminants are not affected by all the parasite. Few are mainly important in case of goat. So I'll discuss little bit about nematode, which is the main group of parasite which is prevalent or affecting the gastrointestinal of the goat. First one is Haemonchus, Trichostrongyles, Coperia, Strongyloides, and Esophagus. Nematodes are the main culprit. So if we see the little bit about Haemonchus contortus, that is also known as stomacore or barbar polum. This is the uniqueness or typical character of this parasite is they are the vigorous blood sucker. If we see the per parasite, 0.05 ml blood is sucked by the this Haemonchus parasite. So in a clinically affected goat, this around 1000 to 2000 parasite may be present in a abomasum. If we see the clinical symptoms, there are two groups, that is acute form and chronic form. In acute form of haemonchosis, there is sudden death and because of serious blood loss. But in case of chronic condition, initial, as because it is a chronic condition, slowly the blood will be losing and there is a weakness, lethargy, and ultimately the due to protein loss there is anasarca. If we see the typical presentation of the clinical cases, severe anemia will be there severe anemia will be the clinically affected patient, and submandibular edema is a typical finding. And one more important thing is that those homuncus are very prolific egg layer. That means in a short span of time they are producing huge number of parasites. Subsequently in a life cycle they are affecting the pasture or grassland. In microscopic view, if we see the parasite, you can see the typical homuncus eggs. One phenomena is related with this parasite in case of sheep and goat, that is self-cure phenomenon. As because if you see the life cycle of the homuncus after laying of the egg by the infected dog, L1 stage, L2 stage, and L3, that is larval stage. The L3 stage is consumed by the healthy animal. So L3 is the infective stage. So it's related with the self-cure phenomenon. It is an immunological phenomenon in case of homunculosis. If a patient or a animal is suffered earlier with this parasite, so it develops the immunity. So when the newly parasite is entered, it gets destroyed by the antibody. So it does not occur in sheep and goat when it is initially exposure. So in second exposure, self-cure phenomenon is exhibited by the patient. These are the few photos and as well as the postmortem finding. In this homuncus infection, loss of body fat in chronic parasitism, anasarca, bottle jaw, as well as typical hemorrhagic or ulcer at the attachment point of the worm. Second group is scar worm. That is in this group Trichostrongylus, Ostrategia, Coperia, Nematodus. These are the affecting organisms. If you see the Trichostrongylus, in commonly this comes with the common mixed infection with the homuncus. The difference with the homuncus, it is that this parasite is not that much prolific. But thing is that due to chronic infection with the homuncus, it causes the production losses. And one more that is related with the Ostrategia. Ostrategia, the typical property is that it becomes hypobiosis. It becomes arrest their growth. Parasite pauses their development and resume their growth when the environment become comfortable. So type 1 and type 2 disease. It is a two types of outbreak of this orb. When the daily intake of the parasite, the infected larva become increased and that sufficient to produce the disease. That is surplus. It is overcome the immunity. So take the parasitic load is upper hand than the immunity. This is a type 1 disease. Second one is type 2 disease. In the type 2 disease, what happens? When the hypobiotic larva, this hypobiotic larva when become resume their growth. So it is a type 2 disease. And in type 1 disease, it is a newly infected condition when there is immunity is less. If you see the clinical symptoms or clinical outlook, in acute condition, there is no emaciation or anemia, but sudden death occurs and due to some leg weakness or unable to stand. In chronic condition, what happens? There is the fecal color of the affected patient is becomes dark diarrhea. That's why the worm is also known as black scar worms. In Ostrategia, the pattern of the ovimusum layer, it becomes nodular. It looks like molecule leather. And another parasite, important parasite is esophagostomum. In case of sheep and goat, that esophagostomum, it causes severe persistent diarrhea. As because of gastrointestinal infection in nematode, diarrhea is a common problem. And in this case, if you see the necropsy, there will be necropsy means in during postmortem, you will finding the nodular like lesion in intestine, small intestine. So this is a typical finding by which you can confirm the diagnosis that it is a esophagostomium infection. And for the confirmation, you can scrape the intestinal mucosa and check the presence of larva as well as the parasite. And next, and that is cystodes. Among these, Monisia expansa, if you see the microscopic view of the parasite, it's a typically triangular. So, and this is the one of the parasite which is clearly diagnosed by seeing the segment in the feces, because this is coming out, the segment is coming through the fecal sample, through diarrhea. And there is one important point is that this large number of monasia which blocks the intestine, stasis of the intestine, which causes ultimately a secondary bacterial infection, that is Clostridium perfringens, which leads to the enterotoxemia. So if patient is not dying by monasia also, there may be a chances of death due to secondary bacterial infection by Clostridium perfringens. Next one, very much important in farm level, that is coccidiosis. Coccidiosis, it is a protozoal parasite. These two coccidia are mainly important for the goat industry, is because these are the highly pathogenic parasite, which also known as a self-limiting parasite, but the clinical presentation is exaggerated by the other intestinal parasite. And goat, mainly coccidiosis is common in case of small age group, in case of kid. If we see the treatment of coccidiosis, it is little bit different from the Helminth group of treatment. So coccidiosis is treated by either monensin, improlium or sulfonamide in different doses. If you see the monensin, 20 gram per ton of feed for the 28 days, it decreases the shedding of the parasite. Next one is improlium. Improlium at the dose rate of 100 mg per kg body weight for 21 days. And sulfonamide 25 to 30 mg per kg body weight for next 15 days. Either of these, if we choose, then we can, as a prophylactic or therapeutic, we can use these drugs. If we see the clinical management of this different group of parasite, in a broad spectrum, we have to go through different pathway. Like we have to check the clinical symptoms. Is there any anemia or any submandibular edema or weakness, or is there lungs are affected or not? Is there diarrhea or not? These are the common symptoms in case of different parasitic gastroenteritis. So by this, if all those symptoms are present, we can think for parasitic gastroenteritis. If we see the clinicopathology of the parasitic gastrointestinal affection, the heavy blood loss due to Haemonchus contortus and protein losing enteropathy in case of Trichostrongylus, and in case of esophagostomiasis due to villus atrophy or nodular formation in the intestine, that malnutrition due to malabsorption of the protein, fat and glucose, and in general malabsorption of the minerals, calcium, phosphorus, magnesium, ultimately leads to their overall development of the muscle as well as bone. So young animal are suffering due to this malnutrition. So for controlling or clinical management, we have to first check the fecal egg count. Fecal egg count per so for this fecal egg count, we have to collect the fecal sample freshly from the rectum or before contamination with the ground. So for this fecal egg count, we should follow this modified McMaster technique. By modifying McMaster technique, we can see this type of things, that is air bubble, pollen, tapeworm. If we see microscopic examination, this pollen, we should not be confused with the parasite. And under McMaster chamber, we have to calculate this different chamber. And if we collect the parasite, if we collect the fecal sample in generally 2 gram, so we have to multiply with the 50 whatever we have counted in the chamber. we have to multiply with the 50. If we collected 2 gram of feces, and we have to multiply with the 33 if we collected 3 gram feces, and 4 gram if we collected, so multiply with the 25 gram 25. These are the few parasites in under microscope, that is Strongyle, Trichuris, Emphistomonasia, Eimeria, Giardia. These are the common parasites which can be seen under microscope. So another important is Famacha scoring, which is known by the scientist Francois Fafamalan, the first Famacha. So this letter gives the name Famacha scoring. So this scoring is mainly based on the level of anemia in patient or animal. As because this Haemonchus contortus causing the severe anemia, this can be used in mainly Haemonchus contortus infection. Here card is available, and there are 5 category of ranking, that is category 1, 2, 3, 4, 5. So 1 depicting the eyelid color, that conjunctiva, that is red. So if red indicating the PCV, that is pexel volume, that means it contributing the level of blood or RBC. If it matching with the 1, that means we should not give any treatment. So subsequently, if we are checking the mucous membrane in pink and white category, we should give the treatment. That means we can suspect that there is involvement of Haemonchus along with the other clinical signs. If it is matching, then we can think of, but it does not mean that if Famacha is matching a parasitic infestation. So that is indicating only anemia level. What is the advantage of the using Famacha scorecard along with the other clinical parameter? That decrease the number of treated animal. That means if there is no anemia, we should not think for like a Haemonchus contortus or we should not go for deworming. So slower resistance to the anthelmintic. That means if you are not treating the patient, so there is a less chance of development of the resistance and selection of for more resistant animal. So these are the few important advantages of using Famacha systems. If we go for postmortem examination in Haemonchus contortus, these are the typical finding we can see, that is pale mucous membrane, which can be also exhibited by clinically, and submandibular edema, and degeneration of the fatty liver and hydropericardium, and fat are generally replaced by gelatinous material. And if we see the content of the abomasum become coffee color due to blood from the abomasal wall, it's coming to the abomasal content. It mixes the with the content and gives the color reddish or coffee color. And trichostongylus, inflammation of the intestine, is because the intestines are heavily suffered by trichostongylus. Next one is Astrategia. It gives the typical morocco leather appearance. And esophagostomum, it gives the nodular lesion throughout the length of the intestines. So in generally, these are the some common finding, postmortem finding in case of goat, that is watery dark color or bloody intestinal content, ascites due to hypoproteinemia, due to severe diarrhea, there is a protein loss, it develops the ascites, and mesenteric lymph node become enlarged. These are the common postmortem finding in different parasitic infestation. If we see the clinical management, depending on the diagnosis, we have to choose the dewormer, as well as the depending on the severity of the dehydration, we have to go for the fluid therapy, as well as if the patient is suffering from severe anemia, we can think for blood transfusion as well. So besides the deworming and fluid therapy, we have to think for secondary bacterial infection also, is because intestinal damage leads to the ultimately translocation of the bacteria from the intestinal tract to the systemic blood. So we have to think for secondary bacterial infection, so we need to go for antibiotic as well. And ultimately all of us, we know, to give the herbal antidiarrheal support, we can go for Nevelon, Diaroc. Those are commonly available in our Indian pharmacy. And vitamin B complex to rejuvenate their health status, as well as the support the blood production, and to support the intestinal microflora or ruminal microflora, we should go for any probiotic mixture, and at farm level we can support with the jaggery mixture. If we say the strategic control of the parasitic gastroenteritis, it is an integrated approach. So in integrated approach, we have to combine different methods, and first one is we have to judiciously or selectively we have to select the enthalmentic. Second one is pasture management and selective deworming, breeding for the resistance, nutritional management, and biological control. If we see the enthalmentics, is because this parasitic gastroenteritis, it is a common in field condition. We have to treat clinically affected patient and for the decrease pasture contamination, especially at the key point of their parasitic life cycle. There are different groups of enthalmentics commonly used: fenbendazole, ivermectin, levomazole, and other commonly available enthalmentics. In general, we are using or going for combination of therapy, that is levomazole, albendazole, niclosamide, albendazole, to make the resistance. The main problem is the resistance. So to overcome this resistance, we have to go for different effective method, that is fecal egg count reduction test. So in farm, we have to go for this deworming fecal egg count reduction test by before treatment and after treatment, to check the parasite is resistant against the particular dewormer or not. For this, we can go for, like, say for example, if 1 week before treatment fecal sample is collected and egg per gram is around 5,000, and deworm done after the fecal collection, and after few days, 1 week, fecal sample is collected from the treated animal. If the 200 egg per gram is counted, so fecal count reduction is about 96%. Fecal egg count reduction rate, fecal egg count initial before treatment, that is C2 is after treatment, divided by the C1, the fecal egg count. So if it is indicating that there is no resistance. If the fecal reduction is less than 50% or 60%, that means parasite is resistant against that particular group of parasite enthalmentics. So how we can resistance these parasites? Avoiding underdosing. So in farm animal, if regular deworming is underdosing, so it makes the parasite resistance against those particular group of enthalmentics. And rotational enthalmentics, like if in a particular period we are using one group of enthalmentic, in a subsequent regular deworming, we should go for another group of enthalmentics and avoid frequent deworming. If we are using frequent deworming, there may be a chance of resistance, as because it unnecessarily we are using for the prophylactic, even though there is no parasite. So all those residue giving the ultimately parasitic resistance. So next comes the pastoral management. There are different types of pastoral management. That is, among these, one is alternate grazing, or another one is multiple species grazing. In alternate grazing, what happens? In a initial or before grazing of the goat and sheep, cattle and buffalo are graze in that particular pasture, as because sometimes the cattle and buffalo are not the common host for this same particular group of parasite, and they make this pasture, it is as a vacuum cleaner. So, and in a multiple species grazing, what happen? Cattle, sheep, goat, and buffalo all together, if we graze, there is a chances of dilution of the parasite in a multi-species, is because all are not the same. They will not be susceptible for the particular group of parasites. And another grazing pattern is rotational grazing. In this, what happen is because all of us, we know this nematode having the life cycle L1, L2, L3. So in this procedure, what happened, the whole paddock or whole field is pasture is divided in a different plotted different plot. So in a particular plot they are grazing. So they, if they are grazing, the parasitic life cycle will be break, and in the rest of the area they are taking the time to for the death of parasite. So ultimately in tropical continent, what happened, climate, the shorter length of the time for survival rate of the migrating larva. That means in tropical climate, the climate is not favorable for the survival of the parasite, which makes them shorter survival outside the parasitic field pasture condition. So it is very easy rotational grazing more effective in this tropical climate. So they will be from here to, they will be moving this plot, and again subsequently they are following the next plot. Another one is pasture resting. In the pasture resting, what happens, for a specific period of time to break the life cycle of the parasite, for a particular period like 2 months, 1 month, resting of the field can be provided so that there is a death of the larval stages. And next one is forage height management, is because the parasites are mainly residing below that 5 centimeter vegetation. 80% parasites larvae are residing. So if we control the parasite pasture height, there is a chances of management. And then another one is zero grazing. So zero grazing, in this zero grazing, what happened, the different well designed area are selected. That is, there is no grass should be surrounding area. The feeder should be proper heighted so that there is a no chance of contamination of the feed along with the dung as well as the feed, and the area should be cleaned, and all the other forages and old feed should be removed. And the before introducing of the goat, there should be proper proper deworming as well as proper quarantine, and monitoring of the goats periodically checks the egg count to control the parasitic gastroenteritis, as well as the avoid the cash pasture. If the in a particular pasture, if previously animal have grazed, we should not give them in a zero grazing pattern. This is one of the video which has been shared already shared in Sathyazerograzing WhatsApp group. If you see this video, you can see that it is a feeder is properly height maintained, and in a three sided, in a pen 3 area, their feeder is designed so that individual goat get the proper opportunity for the feeding. There is no overcrowding, individual goat getting the adequate feeding, and there is a less chance of contamination. So another important point is selective deworming. Selective deworming means deworming only those animals that are showing the parasitic gastrointestinal infection, identifying through the FAMACHA scoring or fecal egg count. There is an advantage that reduce the deworming and increases the refugia and allows animal to develop immunity. So if we see the refugia are the group of parasite which causes the, which are the sensitive, they are not the resistant parasite. If refugia group of parasite are residing with the resistance or normal parasites, they will be diluting the resistant group of parasites. So they will be diluting the resistant parasites. It will be very easy to treat the affected animal. And that is another one important is breeding of the resistance in a particular group of animal. If we see the some animals are inherently resistant against the parasites, so we should go for that particular animal and proliferate those gene. And in a nutritional management, there are literature, it is found that protein intake, if the proper protein balance in the diet, there is a chances of resistance parasites, resistance to gastrointestinal infection. That means if the balanced diet with the protein, there is a chances of parasite infection very less. And as is also related with the phosphorus, cobalt supplement, which increase the gastrointestinal immunity against the gastrointestinal parasite, as well as the molybdenum. Along with the molybdenum, decrease the parasite burden in sheep and goat. And another new approach, that is a biological control. In biological control, there are one living organism which destroying the parasites. That is, one is earthworm, another one is dung beetle, another one fungus is available, that is nematophagous fungi, which earthworm, dung beetle, and nematophagous fungi. So earthworm kills the parasites, as well as the larva, egg larva, those are present in the pasture or soil. Earthworm, what causes earthworm? Transfer those in a deeper level in the soil level. So it is very difficult to get infected by those egg or larva. And dung beetle, which then deteriorate or damage the dung and parasites. And nematophagous fungus, which is causes the hyphae, which causes the damage of the cuticle of the parasites. By this beetle as well as earthworm, we can manage biologically. And other approach, that is copper oxide or wire particle, which is under research, as well as it is used in American country, that is which control the parasitic gastrointestinal infection, as because it enhances a long lasting dissolved copper needle, mainly involved in the highly pathogenic parasitic infestation. Another one is control release capsule. Control release capsule, in the content of the control release capsule is ivermectin. So it's continuously for 100 days it releases the ivermectin in an animal body, which kill the parasitic gastroenteritis. So we can control this parasitic gastroenteritis by these new approaches as well. If we see my perspective in alternative therapy cannot replace the commercial treatment, but they can complement with the commercial treatment. If we see the main important thing, the parasitic gastroenteritis, it is not, the control program is not to eliminate the ore, but to decrease the burden of parasitic gastroenteritis, and so that there is a minimize the negative impact on the health, as well as the improve of the productivity of the animal, as well as the so that enhance the economic status of the farmer. For that, we need to go for integrated approach. Thank you, one and all.